This is the State of the Union conference from beautiful Florence and online on the official website of the event, on the platform of the event and on social media. We do see all of your questions, all of your comments regarding all the sessions that are happening here today and tomorrow. Please do keep them coming as well for this next session, EU and Africa. Although Africa has managed the COVID-19 crisis remarkably well compared to many other parts of the world, the economic consequences have been disastrous, and therefore the cooperation between the European Union and Africa is more important than ever. Please welcome the moderator for this session, Giorgia Giovannetti, Vice President for International Relationships of the University of Florence, visiting fellow at the Robert Schuman Center, European University Institute.
Thank you very much. Welcome, President Barroso. I'm really happy that you are here with us at the State of the Union. President Barroso doesn't need much of an introduction. He's the former president of the European Commission, and before he was Prime Minister of Portugal. But now, since January 2021, he has taken up a real new challenge, a very, very important challenge. He is actually the chair of Gavi, the Vaccine Alliance. Who better than him could start this conversation, which is going to be on the EU-Africa cooperation, and let's start with vaccine. So, President Barroso, I would like to ask you something about, now that you are the chair of Gavi, I would like to ask you something about Gavi. How do you see how it works, just as a way of introduction, please?
So first of all, thank you, Professor. It's a great pleasure to be once again in the European University Institute. Gavi, it is an organization that was created 20 years ago, and it's a very interesting format because it's a public-private partnership. We have in the board has 28 members, exactly the number of members I had in the European Commission before, of course, Brexit. It has 28 members. 5 represent the developed countries, the donors, 5 in each constituency, 5 represent the so-called implementing countries, and there are afterwards the founding partners, this World Health Organization, UNICEF, World Bank, Bill and Melinda Gates Foundation, and we also have representatives of the pharmaceutical industry, representatives of the civil society organizations, representatives also of research institutes, and 8 independent members, among them the president, the chairman of the board. And it was created 20 years ago. It has already contributed to vaccinate half of the world's children. We estimate that at least 14 million deaths were avoided thanks to the action of Gavi, that is trying to concentrate its action there in the more vulnerable countries. And in fact, we have introduced 500 vaccines for 17 infectious diseases, from yellow fever, measles, polio, influenza type B, hepatitis B, many others, including, by the way, a very important action that Gavi had fighting Ebola. And now Gavi is stockpiling the reserves of for doses for Ebola. As you know, there have been some surges once again in Western Africa after the very big and dramatic outbreak we had in 2014. I remember well, I was still in the Commission at that time. Most of our action at Gavi has been in Africa. In the last 5 years, 64% of the budget of Gavi has been dedicated to Africa action. And in fact, there is a symbolic thing that I believe is very important. The first chairman of Gavi, of the board of Gavi, was precisely Nelson Mandela. What a better inspiration could we have at Gavi for working more with Africa, not only as a natural partner, but also one of those continents that needs more the participation of Gavi. This is basically what the organization is.
So let me ask you something else. COVAX, you started COVAX, and COVAX is actually the way to secure global and equitable access to COVID-19 vaccine. So it represents the best hope that we have now for ending the crisis. Can you say something more about how COVAX works, and do you think that actually is fulfilling its role?
COVAX was created precisely as an initiative of Gavi, because Gavi, having that know-how of distributing vaccines all over the world, but specifically to the most vulnerable countries, it was important to do something. And so COVAX is an alliance with World Health Organization, Gavi, another organization for vaccines called CEPI, and also UNICEF. And the goal is, of course, to reach equitable distribution. So if you ask me, are you going to do it? Yes, but there are many, many problems, to be very honest with you. We have seen problems of production of vaccines. We have seen problems of distribution and supply, export restrictions, vaccine nationalism, accumulation of many doses in countries that don't need so many doses. So in fact, we are now, Gavi, COVAX, distributing vaccines already to 120 countries, most of them, in fact, from the so-called developing world. 92 countries are part of this coalition of 191 countries. But the reality is that as today, we can say, and that's dramatic, this polarization, 1/3 of the people of the wealthiest nations already have received some form of vaccination against COVID, while in low-income countries, only 0.2%. So it's completely unfair, the situation. To reach our goal, and the goal of COVAX is until the end of the year to reach at least 2 billion doses distributed, and one of those 2 billion doses, 1.3 billion should be for the low-income countries and low-middle-income countries. To reach that goal, we need urgently to solve some problems. First of all, end export restrictions that we still have. Secondly, dose sharing. This is the most immediate way of solving the problems we have now. Countries that have many, many vaccines surplus can do it. We already started to do it partly in Europe. France has made it already. There was a concrete case, by the way, organized by COVAX. There were announcements made, very generous, from Sweden to Spain to Portugal. There are also the countries outside of Europe that they are saying they will do it, from UK to New Zealand. But frankly, we are not yet there. And we need also more funding, because we already have secured 6.7 billion euros. And by the way, 2 weeks ago, I hosted with the Secretary of State of the United States, Antony Blinken, an investment opportunity to mobilize for more funding, but we'll have the big event on the 2nd of June. We need $1.6 billion more to complete our program for this year. So the honest answer to your question is yes. We have already demonstrated that we can deliver, because we have been able to distribute in 121 countries, to be precise. But we are far from the objective, because there are problems like the ones I've mentioned that are not yet solved, and they need to be solved as soon as possible.
Thank you very much, President Barroso, for your intervention, and thanks for having been with us as the State of the Union. And we really hope that we will solve the problem. We also have a roundtable now on the same topic, and we'll also try to provide some hints on how to solve this problem. Thank you very much.
Thank you.
Bye.
Bye.
So let me now introduce the panel that we have on the Africa-EU after COVID-19. Let's start with vaccine. Let me say that each of the speakers I'm going to introduce now has and has had a very important role in the development of the EU-Africa cooperation on equal ground. Each of them has a solid theoretical background as well as a great experience in policy on the ground. So let me introduce Stefano Manservisi, who is the special advisor to Commissioner Paolo Gentiloni and has covered many different leading positions in the European Union, up to being Director General for DevCo. He has been the head of cabinet of Commissioner Mario Monti, President Romano Prodi, High Representative of Foreign Policy Federica Mogherini. Welcome, Stefano, to the panel. Let me then introduce Jane Mariara. Jane is the Executive Director of the Partnership for Economic Policy, PEP, This is a research center which is very important because it aims at promoting Southern-driven development and informed policy decision with high-quality, locally generated evidence. Jane is also a professor of economics and an expert on green transaction and biodiversity. Welcome, Jane. And then Vera Song. Vera is the Undersecretary General of the United Nations and Executive Secretary of the Economic Commission for Africa. She's the first woman to lead the institution in its 60-year history. Before, Vera has held a number of senior positions in the World Bank group, both at the World Bank and the IFC. She's also a member of the African Union Institutional Reform Team under the direction of President of Rwanda. Welcome, Vera. The title of this panel was decided a few months ago when we thought that we could meet in person, and when I first invited you, I really hope that you could come to Florence and see the beauty of the city. We also thought that the pandemic will be over. We are still in the middle of it. So I want to ask you a question. As you heard before, President Barroso said that on average, 1 out of 4 people has received the COVID-19 vaccine, while in Sub-Saharan Africa it's just 1 in 500. So do you think that the COVAX initiative that we spoke about with President Barroso in its present form is enough? Vera, I would like you to start this discussion.
First of all, let me thank you very much for having us here today at the European University Institute. Thank you and for having this discussion. It's an honor to be on the same panel, of course, with President Barroso, good friend Stefano, and of course, a strong woman leader on the continent, Professor Jane. Is COVAX enough? I think we have to start by, first of all, saying, you know, on the continent, we need vaccines from everywhere and anywhere that we can get them. That's the first principle. It's just get the vaccines. And what is COVAX doing? COVAX is delivering vaccines. So obviously COVAX is an important component of the vaccine conversation on the continent. But I think as we have seen, when COVAX was announced, COVAX was honest and COVAX was transparent. COVAX said, we're going to provide vaccines for 30% of the population. But we all know that Africa needs to vaccinate at least 60 to 70% of its population to get herd immunity like everybody else. So what we have done at the African Union under the leadership of then President Ramaphosa and now President Tshisekedi has been to say we'll create an African initiative in parallel to COVAX, which complements COVAX. And so essentially, while COVAX is looking for the 30%, the AVAT initiative, the African Vaccines Acquisition Task Team, is also trying to work to procure vaccines. And I think that this combined initiatives hopefully will be able to deliver. Now, whether it's COVAX or whether it's AVAT, I think the big question is where do we get the vaccines? And we made a mistake, and I think we are all realizing that now, that you know, a lot of the vaccines that were meant for the developing world, whether it's Africa or Latin America, were going to be sourced from the Serum Institute in India. And very quickly, Serum Institute first became overwhelmed, and then India became overwhelmed. And so there's no vaccines getting out of Serum Institute, or at least no vaccines getting to the developing world from the Serum Institute. And so we're very fortunate under the African Vaccines Acquisition Task Team to have been able to secure some supplies, 220 million with the help of Afri-Exim Bank. So it's African finance of Johnson & Johnson vaccines. COVAX is still delivering, and I think COVAX is providing something that's important. They were the first ones on the ground in many of our countries, I think 30 countries today. And so they have also been able to start prepping the reception process, because it's not just getting the vaccines, it's also about delivering them and finally having the vaccines in the arm of a citizen. And I think that whole process of the preparation in coordination with Africa CDC that has done a fantastic job has already started, and we can, with COVAX, begin to learn what's happening. AVAT has delivered some, and we're also learning what's happening. But overall, whether it's AVAX, whether it's COVAX, we need more vaccines. We need to produce more to get the 60-70% herd immunity.
Thank you, Vera. Jane, would you like to add something to this question?
Yes, thank you. And thank you very much. Let me also first join Vera by thanking you for making us part of this panel. Of course, it's a shame that we couldn't meet when we were supposed to meet, but I'm sure an opportunity will come. I'm really delighted to be part of such a distinguished panel. So I'll pick up from where Vera has left, maybe without repeating a lot of things. My answer is yes and no, that it's of course not enough, but I would look at it like they are the benefits, they are the challenges of this initiative. And first say that it is a very innovative strategy, and really we need it, especially in the developing South. What I see as the plus or the main benefits of COVAX is that it's a critical tool for collaboration and innovation, especially in supporting compliance to the WHO equity framework, whereby countries that, of course, cannot produce their own vaccines can actually be covered under this. It's also a mechanism that, of course, helps us in building capacities through training, technical assistance, access to guidelines and tools, especially in the developing world. And then it also strengthens the bargaining power for the pricing of vaccines and other commodities for the production, and also promotes economies of scale in production and distribution mechanisms. And finally, I would look at another advantage as the fact that it encourages clear division of labor among agencies, which is good for supply chain management and also improving the quality of response globally. That does not mean that it's without challenges, and Vera has enumerated quite a number of them, and Barroso also did mention some of them. Of course, the key main ones is that the partner countries and institutions, of course, as we know, have been accused of supporting measures that advance vaccine nationalism. And of course, this leads to high inequalities in access, favoring high-income countries, and of course, constraining the global South. The second issue is about vaccine production networks, which are located away from the needy countries, and therefore not just increasing the cost of access, but also issues to do with refrigeration and so forth. Again, Barroso did mention the production constraints that have been noted. Then that there's the weak country readiness and delivery mechanisms, which have caused delay in timely delivery of the second doses, and therefore eroding the confidence. Vera has already said what has happened, first with the Serum Institute of India, and we really do not know whether, especially the group of South that was relying on India, whether the second dose will ever come or not. And then in the process, there's of course the question of the new mutations and whether they'll be compliant to the second doses, if at all. Thank you.
Thank you very much, Jane. Stefano, do you want to add something on this topic?
Well, thank you. First, thank you very much, Giorgia, for this invitation. A pleasure to be with you, to be with my President Barroso and with so many friends. So it's really an exciting moment of discussion. I have to say, just to add my consideration also on the basis of my experience, is that we have, let's say, to situate COVAX in the framework of what is this pandemic and what is raising and accelerating. You know, this pandemic has hit and is still hitting, you know, people and systems. And I think that we need to see what kind of purpose COVAX was given in order to intervene in the most urgent, in the most, let's say, appropriate way to deliver vaccines. So, but the crisis and the hitting of the pandemic is much wider. So there are systems which are under stress, the whole the health system, there are capacities which must be invented, and it is not an easy thing to fix. So there's not just distributing vaccines. It's a whole system which must be put in place. Now, let's situate COVAX on this. COVAX is also given a task, which is to address in priority healthcare people, all those which are supposed to be on the front line. So it's not an instrument which has been designed in order to address the whole of the pandemic. It's to address what is the most immediate. And it has been built as a multilateral, let's say, experience. So therefore, from this point of view, I think that COVAX is extremely important and it must be supported without any hesitation, But it is also evident that it must be supported because it is an experience of multilateralism. And I think that also in these days, this is particularly important because we have seen how divisive, let's say, pandemic is, and it could be even more. So therefore, is a way to work together independently from, let's say, the positions and independently also from politics. But, I mean, is that enough? I think it's necessary, but it's not sufficient in the sense that, as we said, it has a limited target and it must reach this target. Second, most important, it's dependent from the production available and therefore to the obstacle also of this production and the availability of products. And it depends from the donation goodwill of the partner. So it is an instrument that, if I may say, in dealing with a complex challenge, is a bit like humanitarian versus the structural development. It is necessary, but it is important that it is plugged into something which can complete the intervention in order to support the structural reforms which are necessary, the health system, but also the entire ecosystem in which this is inserted. It's not just to have vaccines, by the way, in number still reduced, as President Barroso said, and this must be increased. But it is not enough because it's not deemed to be enough. It must be accompanied by efforts elsewhere, which are typically, if I use this image, is typically of the nexus between humanitarian and development. COVID is necessary to front load, to have an impact in the short term is big humanitarian operation. But if it is not completed by what is a more structural financing, more structural access to all the technology, more structural activities, which is, let's say, transforming the health system and the ecosystem in which, let's say, this health system are put, this will not be enough. Also because, we are not talking about something which once you got your vaccine, then it's over. You need to have a system which is able to deal with variants every day, and with the second and the third waves of vaccines that will be needed. So therefore, in short, COVAX must be supported, must be financed, must be helped, and must be nurtured on this. But it is not enough. It must be completed quickly with structural interventions, which makes this even more effective and the humanitarian part fulfilled, but a bit more is needed.
Thank you very much, Stefano. I think all three of you have pointed out to the long-term importance of a policy, of a cooperation policy between Europe and Africa. And you also pointed out about the financing. But there is another issue which is also very important, which has been taken up by India, South Africa, and other developing countries, but also today was in the news because apparently the American administration has changed idea and will support it, and is the temporary waive of intellectual property rights for the duration of the pandemic. Vera, I would like to have your ideas on that.
Yes, no, thank you. I think we're all very satisfied and very pleased with this opening. We know that all day yesterday, WTO has been discussing this, and so this is one, I would say, almost first win for a revived and collective WTO that is making an impact in the world. And I want to recognize its new leader, of course, Dr. Ngozi Okonjo-Iweala, who is helping us steer this initiative. I think that we have all seen, whether be it developing or developed economies, the lack of vaccines. And we know that we can produce them because many factories can be repurposed. And so the whole conversation around TRIPS was whether we wanted voluntary reallocation or voluntary offering of these licenses or compulsory. So where businesses, pharmaceutical companies that had developed these vaccines, is the ask to them to say, voluntarily, you can give this license out so that many more factories can produce vaccines, or we should make it compulsory. I think that's where the discussion is. And the question then becomes, even if we were to make it compulsory, do continents have the ability to produce? And the good thing is, the answer is yes. Actually, something that we are very proud of on the continent is that today, Africa is the only continent that is actually exporting vaccines, because we produce Johnson & Johnson in South Africa. And unlike everybody else that has said, until I vaccinate all of my populations, I'm not letting vaccines out, we are letting vaccines out of the continent. But we could do more, we could do faster. So the decision yesterday by the Americans, the WTO hasn't yet pronounced, the Americans have given us some indication of where they will go. And we know that when the Americans indicate a direction, it's always in the positive. So I think we all woke up, went to bed last night, very happy with that direction. And we hope that today something even stronger will come out of the whole WTO family in this direction, because I think across the world, there are factories ready to go, from Germany to France, to South Africa, to Senegal, to India itself. I think more factories need to go into production too, and our thoughts are with the Indian people at this time, and to do that. So yes, really great idea that happened yesterday, but it's not done yet. We need the decision, and then we need financing to actually make it happen.
That's a very important point. Stefano, do you want to add something on this issue?
Well, I'd say that I'm very pleased by the decision taken by the United States. And I think this is a right decision. It's a long due. Personally, I would have hoped that the European Union would have taken first, but I think that somebody should do, and therefore the United States did. And I hope that the European Union will follow course quickly. Why it is important? It is important precisely because, as I said before, it is a whole system which must be put in place in order to be effective in fighting COVID, which is not only vaccines, but is also the system. So therefore, you have to unlock all the potentialities. And therefore, I think that first, it is obvious, it's important because it is obvious, as President Barroso said, that quantities which are produced and available today are not enough. So in other terms, the production must increase anyhow. Second, I have to say that, COVAX and all the approaches like COVAX in other areas are donorship, if I may say so in this way. While, allowing production in countries is partnership. We are saying, that we are passing from donorship to partnership, etc. Let's do it. This is the way in order to organize a system in which certainly there is something which is front-loaded, given, donated by producers, but the solution is only if in partnership we create capacities, production, and ideas, I have to say. It's not just mechanic, it's not a factory only, it's create ideas. So therefore, it's partnership and not donorship. Third, because in reality, it's not a question just to wave on a duty, because the issue is transfer of technology, industrial collaboration, technical assistance. We are entering through this into the dimension I described before, a sort of whole of the system approach, which is necessary in order to, in the medium and long term, to be better equipped all together in order to produce, to know what we are talking about, and to maybe invent, also sharing. This is the big issue, and the second and third reasons why I think this is necessary. But there is also a fourth reason. We are talking about the fact that whatever international partnership cannot, let's say, do it without the private sector. So I deeply believe that once all the dust will be settled, and then obviously big companies are a bit concerned and even protesting, etc. But I don't think that a move like this must be understood as going against the private sector. On the contrary, this will require a deeper and different collaboration with the private sector. I mean, this has been, or it is likely to take off an obstacle, but not to solve everything. It's a starting point of, a discussion in which all the different elements of this very complex puzzle will be put around the table. So therefore, what at the end of the day will be necessary is a global system which is able to respond together with solidarity and shared capacity to a global pandemic, which today is called COVID-19 as we know it. But tomorrow could be called also in different way, because we have seen that these kind of things can happen again. So therefore, this is essential. So it's not a magic solution, but certainly it will help. And not to consider, access to vaccine and the technology which is linked to that, which will be necessary to be transferred in partnership with the private sector, which will require the money, which is not going to COVAX, but is going to the countries in order to allow them to produce it, This is the response which is necessary. And I think that we will be facing difficulties at the beginning, of course, because, there are the usual tensions, but at the end, this is the right things to be done. And we have all to hope that a solid agreement will be found in WTO. Everybody's playing, everybody's putting money, everybody is sharing, and it's not a question of theoretical solidarity, but really of practical working together, because we are all at risk, as we have seen so far.
Thank you very much, Stefano. Jane, if you don't mind, I will ask you a different question, because your research institute has been doing a lot of research on COVID-19 and the economic consequences of that. So my question is, what can this research teach us to inform policy in real time? Can you briefly explain that to us?
Okay, thank you for that question. As you say, we are actually carrying out a lot of research, looking at the impact of COVID-19, what rapid response policies can do or what they are doing. Currently, we have research that we are doing in 11 countries all over the world. Of course, it's more because it's more research, but we have research in 7 African countries. We have research in 2 Asian countries and 2 South American countries, at least something that I can share from that. And basically what we are doing in this research, as I've said, is to look at the short and long-term challenges caused by COVID-19 and then see what policy can do, or how can we inform policy on that. What we are finding, maybe just talking about what you can say from the results, is first, what we have seen is that the stimulus packages that are being adopted, whether they are cash transfer programs or any other initiatives in the Global South, are actually having quite some impact. And therefore, we feel that it is very important for the countries to think maybe think about rapid policy responses that they can put on in the face of the pandemic, because they are actually reducing the impact of the crisis and helping to cushion welfare, especially of the most vulnerable populations. For instance, in Argentina, we have found that quick policy responses prevented about 1 million people from falling into poverty, and most of these are female-headed households. We also found that emergency cash transfers in Argentina, for instance, actually prevented the average household income from falling by about 23%. But the story is not the same in other countries. For instance, in Ecuador, we found that the responses, especially related to emergency transfers from the government to poor households, actually worsened the situations. It's still not clear why the effects were adverse, but we find that actually household incomes, poverty rate seems to have worsened instead of improving. And this is mostly the case for households that are in the informal sector. In other countries such as Vietnam, we found that incomes declined due to the pandemic, irrespective of the policy responses that were put in place. And these were most significant in service sectors such as the hospitality industry, in transportation, in agriculture, in education and health, though we found that agriculture, education and health were not as much affected as the hospitality industry. Coming back home to Africa, we found that in Ghana, for instance, in spite of the policy responses, about 1.47 million people actually fell into poverty. And it was worse for, surprisingly, for male-headed households than for female-headed households. The effect was much harsher in the rural areas than in the urban areas. And of course, we know that in the rural areas, the sectors are agriculture, forestry, maybe a bit of fishing, restaurants, and hotels. In Kenya, we looked at it also, and what we found that is that agriculture and food commodities, imports and exports were both adversely affected, of course, because of the effect on the global value chain, which actually adversely affected agricultural commodity markets. Nigeria, we found that the effect is expected to be about 5% lower GDP in 2021, and an increasing gender wage gap in employment, where, of course, female workers suffer greater job loss than their male counterparts. We have other countries such as Pakistan and Zimbabwe, but for the interest of time, let me just mention that looking at the policy lessons or what policy can inform us in real time, first, what we have found is that these countries need to think about, or countries in the global south need to think about how they can combine direct cash transfers with employment support where possible. And then we also say that the depth of the crisis requires broad targeting of the population to ensure that there's no exclusion of the most vulnerable. We say that you'd rather have an inclusion era rather than an exclusion era. And then it's also very important to incorporate gender dimensions in government assistance, especially when we are looking at the effects of COVID-19. Finally, maybe just to mention that for social effects of the crisis, I've already mentioned increased poverty and inequality. And now this, of course, will become worse given that we are saying that access to vaccines is also going to increase the inequalities. There are long-term effects such as loss of human capital that need to be addressed by policy. The gender impact, employment, and poverty needs to be addressed by policy. And most important, for the fiscal impact and policies, of course, there's a recession in these countries. That's an open secret. Loss of revenues due to recession, and especially effect on manufacturing. And finally, of course, government expenditure has had to increase unproportionately. So maybe that's what I would share for now. Thank you.
Thank you very much, Jane. I have a lot of other questions that I would like to ask you, but I'm having some questions from the audience, and I think we should give the last 10 minutes of this roundtable to the question of the audience. One which is very related to what Jane just said is coming from Liberia, and the question is, what measure are African leaders putting into place to ensure that the COVID-19 vaccination is compulsory? So I would like your opinion on that, starting with Vera.
No, thank you. I think that's an important question. We have to remember that when we vaccinate ourselves, or when we prevent ourselves from getting COVID-19, we are actually not only saving ourselves, but saving our communities. That is one of the problems with COVID. The African leaders, I think, have worked really hard, and this is maybe part of some of the support that we've gotten both from WHO, Africa CDC, COVAX, and other multilateral institutions, is, Africa has a tradition of vaccinations. We've been vaccinating on cholera, on malaria, on tetanus. And so, and we have a young population that is continuously being vaccinated. So there's a lot of communication, information campaigns going on. Of course, our leaders, like every other leaders, are being vaccinated openly and publicly to ensure that people understand. The United Nations in many countries, beside the WHO, is doing a lot of campaigns. Now we have a little bit of an advantage, particularly in West Africa, because in West Africa, when Ebola hit, we used a lot of our community organizers, a lot of the priests, a lot of the community leaders to be able to sort of communicate these messages about why it was important to vaccinate. So our leaders have gone back to those same systems to communicate on the vaccines. A second thing that they have done is really use civil society. Civil society has been particularly effective at communicating the importance both of the need for prevention, so wearing masks, washing hands, social distance, but then also the importance of the vaccine. So I think we have seen leadership at every level, at the multilateral level, CDC Africa, WHO, the COVAX facilities, but then at the individual local levels, remember that it's really, people trust their communities more than they trust their governments in most cases. And so when you see your community leader being vaccinated, then you feel the need to do it. And that's what's been happening on the continent.
Thank you, Vera. This was a very important intervention to point out the role of the civil society and the role of the communities in Africa. I would like to ask to Stefano something which is sort of related, which is another question from the public, which say reaching high and equitable vaccination rate, especially in countries in situation of fragility, is difficult. And how do you suggest to tackle this issue? And this is, I think I linked it to the one of what Vera said, because in the country of situation of fragility, it's actually probably more difficult to identify the communities to whom to refer. Stefano.
Well, thank you. Indeed, it is absolutely linked to what Vera just said. I mean, let's say the following: that vaccination is, let's say, one element of a chain, which starts with awareness, prevention, treatment, and follow-up. Then, it is exactly, let's say, a concrete implementation of a challenge, which is how to rebuild a state which is collapsed or close to collapse. So in other case, I mean, all what we used to call the fragile situation, all states which are, let's say, which have a problem of standing, in terms of budget, in terms of credibility of institutions. So this is the challenge. And therefore, it is clear that we have to, let's say, build this sort of chain. We start from the credibility, which is heavily dependent from the connection with civil society, because where institutions are weak, civil society is the real reference in order to start a process. To look at that as a process, is a process of rebuilding, let's say, a social pact and the credibility of a governance system, which eventually will imply institutions which are delivering vaccines. So what I want to say, therefore, is let's concentrate on COVID and vaccines, but let's not, let's say, lose sight of the fact that this is one of the extreme, let's say, challenge in environments and system, those of fragile countries, in which, every time we must be aware of the fact that there is an emergency phase. That's the reason why I said before, COVAX is extremely important in order to deal with emergency, to deliver quickly and must be supported, which we usually call humanitarian. But then we have to build with the societies, with the communities, a resilient system, which is able to produce by itself, all the element of resilience. And we have to put vaccine into this category, because it's not only to have the job, but also the capacity of delivering, is the system to reach also those which are far away, and to have the consensus. Every time, vaccination in Africa is something which is widespread, but also part of an approach which is much wider, in which, you need to factor the credibility, the effectiveness, the transparency, and the culture, which must support all this. So therefore, it's a complex, but it is a clear example of rebuilding and helping in building resilience, and access to vaccine and the creation of a system which is delivering effectively is a huge contribution to rebuild this resilience and this, let's say, credibility of the whole system.
Jane, thank you, Stefano, very much. And I would like to pick up on one word that you have used several times, which is resilience, to ask a question to Jane. My question is as follows. Sub-Saharan African countries in the recent past have tackled several health crises. They were also mentioned by Barroso in his introductory remarks. Do you think that this is what has given Africa, Sub-Saharan African countries more awareness and social resilience to face the pandemic?
Okay, thank you for that. Yes, as actually has mentioned by President Barroso, Africa has had experience in dealing with pandemics, and especially Ebola. He elaborated on that. And actually, I would say that one of the reasons that, or there are many reasons that, of course, African countries ran from Ebola, and one, they are actually using them today. And for instance, the first one is the use of locally embedded information dissemination campaigns. This has been mentioned by Vera in a way. I think this is the same thing that the governments are doing to ensure that they sensitize the people, create their awareness, ensure that they keep away the pandemic, they accept vaccines and so forth. Two, it's community engagement. Again, it has been mentioned by Vera, and this has been a very important factor, not just for vaccination itself, even against Ebola and now against pandemic, but also fighting misinformation and resistance, because there's been a lot of resistance in uptake of vaccine, for instance, in some countries, but community engagement is helping a lot. And then that, of course, there is the use of context-based strategies, because some of the countries, especially in Western Africa, DRC, and so forth, that have had to deal with Ebola, they now know the strategies that they can use, especially to reach the most fragile and conflict areas, which are actually at higher risk of the virus. They were at risk of Ebola, and now they are at risk of the pandemic. And finally, I would say that Africa has leveraged on experience and trained health personnel using the community health outreach models to ensure that there is awareness, there is treatment, and there is distribution even of the vaccine. Thank you.
Thank you, Jane, very much. I think we are at the end of this panel, and we have a lot of other questions coming up from the audience, but actually I think we should close. So let me say a few words about this, what I can sort of come out of, I can see coming out of this panel. I think you all agree on several keywords that have come up from several of you and several times. That COVAX is actually very good as an initiative, but is not enough, especially because of the target it has. Therefore, we should all cooperate more. And one of the questions which I have in front of me is there anything in place to stop richer country buying up supplies of vaccine before poor country? I think that's the big things that you have all been discussing. And I think that's a big question that we have for the future, I will say, for the next edition of the State of the Union, which I hope will be over the COVID-19 pandemic and will be in person. And I really would like to have you all to discuss issues of cooperation of EU-Africa in a different context without the pandemic and in person in Florence next year. So it's really important, the discussion we have had, and I really want to thank you very, very much for the intervention and the care that you took in answering this question and the research that you provided, and for your role in the leading institution to actually help solving a crisis like the COVID crisis. Thank you very, very much for all of this, and I hope to see you soon in person.
Thank you. Thank you very much.
Thank you. Thank you.
Pleasure.
Thank you. And
Bye.
thank you, Stefano and Vera.
Thanks, Jane. Yes, thank you.
Bye.